So you have thyroid disease in your pregnancy. And above all, you are worried about the risk that this condition poses to your baby in pregnancy. If you want to know about what thyroid disease is in pregnancy, the risk to both yourself and your baby during pregnancy, as well as how to manage this condition in pregnancy, this is the video for you. Hi ladies, I'm Dr. Kady. Welcome to Hey Doc. On this channel, we talk all things women's health, and more recently, we've also started to address all things pregnancy. So, first things first, what is thyroid disease? Thyroid disease is simply a group of conditions that affect the thyroid gland. The thyroid gland is a butterfly-shaped gland that is located at the front of our neck. And the reason why the thyroid gland is important is because it produces hormones that are crucial in controlling various physiological processes in the body. These processes include metabolism, growth and development, heart function, temperature regulation, energy levels, as well as the reproductive health. With regards to reproductive health, the thyroid gland has a specific impact upon the menstrual cycle, fertility, as well as pregnancy outcome. Hence the reason why thyroid disease is an important condition to consider in pregnancy. With regards to the hormone that the gland makes, the gland is able to extract iodine from the bloodstream. This iodine is then used to produce the two key hormones that the gland makes. Those are T3 and T4. T4 is made in greater quantities. However, T3 has been shown to be more potent and more active at cellular level. There are those who are of the school of thought that screening for thyroid disease in pregnancy is not an absolute must. However, I am of a completely different opinion, and you will understand why I consider screening all pregnant women for thyroid disease is an absolute must. Once I discuss the complications that thyroid disease can cause in pregnancy. However, I am fully aware that not every woman will be able to afford every single blood test that is recommended. So if you have to pay for every single blood test that you have to do in your country, and you are wondering, what should I spend my money on, and what can wait, or what can I afford to forsake? I would say if any of the four situations that I'm about to describe are true for you, then you cannot afford to forsake doing a thyroid function test early on in your pregnancy. So screening for thyroid disease should be done between 6 and 8 weeks, in my opinion, for all women. But if you cannot afford it, if you have previous history of thyroid disease, you have symptoms of thyroid dysfunction, you have other autoimmune conditions like lupus or diabetes or rheumatoid arthritis, any form of autoimmune disorder. And finally, if you have had a history of preterm births or miscarriages. Now, let's look at the two main types of thyroid disease that can happen in pregnancy. The first is hypothyroidism. In this condition, the gland produces an insufficient amount of thyroid hormone. The most common cause of hypothyroidism is Hashimoto disease. In this condition, the immune system of your body, which is supposed to help you fight infections and any other foreign attacks to your body, actually thinks that your thyroid is foreign to your body, and so starts to attack your thyroid gland. And as a result, your thyroid gland is unable to make enough T4 and T3. So if this condition is not recognized early enough, and as a result is not treated in pregnancy, the symptoms that you will start to experience include fatigue, weight gain, cold intolerance. And that essentially means that you feel cold when other people feel warm or feel that the temperature is normal. Dry skin, dry hair. Your doctor might say to you that your heart rate is actually slower than it should be. For some ladies who have hypothyroidism, they may actually start to experience hair loss. And finally, another symptom that you may experience, and you might just put it down to pregnancy, but it's actually because your thyroid gland isn't working properly, and that is constipation. Constipation is very common in pregnancy. However, if it is consistent and not responding to laxatives, then think outside of the box. Could this be hypothyroidism in pregnancy? The second type of thyroid disease that can happen in pregnancy is hyperthyroidism. And this type of thyroid disease is simply characterized by an excessive production of the thyroid hormone in pregnancy. The most common cause of hyperthyroidism is Graves' disease. In this type of thyroid disease, the antibodies, which are also part of our immune system, begin to stimulate the thyroid gland, resulting in this excess amount of the hormone that is seen in hyperthyroidism. So if you have this condition in pregnancy, what you'll observe is weight loss, heat intolerance, unexplained diarrhea, nervousness, irritability. You may even experience some tremors and feel palpitations. At the extreme end of things, some patients have also experienced trouble sleeping. Now that we know about the condition, the different types that they are, and the symptoms that you can experience whilst you're pregnant if you have this condition, I'm sure most of you are now more interested in what that actually means for you, your baby, and the pregnancy itself. Now, the risks I'm about to discuss will be the same whether you have hyperthyroidism or hypothyroidism in pregnancy. First, let's look at the risk to you as the mother. If you have thyroid disease in your pregnancy, you are at a greater risk of developing anemia, and that would simply means that you do not have enough circulating blood for both your baby and yourself. You can also be experiencing muscle pain and muscle weakness. A really serious complication of thyroid disease in pregnancy is heart failure. And finally, a rare but potentially life-threatening complication of thyroid disease in pregnancy is myxedema coma. When it comes to fetal health, both types of thyroid disease will cause development issues in the baby. And more specifically, that will include low birth weight and impaired neurological development. When considering the risk to the pregnancy itself, women who have thyroid disease are at a greater risk of experiencing miscarriages, preterm births, or preeclampsia. Preeclampsia is really high blood pressure in pregnancy that can lead to systemic organ failure. Now, for a second, let's look at the babies of mothers who have hypothyroidism. As the thyroid hormone is a crucial hormone in brain development, babies born to these mothers are more likely to have intellectual disabilities, as well as developmental delays if the condition is not recognized and treated soon enough. Now you see why I say that all women early on in their pregnancy, as soon as 6 to 8 weeks, should be screened for thyroid disease, because a lot of women may not get any symptoms at all. These symptoms are all well and good if you recognize them, and sometimes they're non-specific. You might get 1 or 2 of these symptoms and you might not put it down, and your doctor might not be able to tie the knot and realize that you have thyroid disease. But if you do the blood test and you are screened early and you are giving the treatment that I'm just about to mention, then your baby can be spared of such a significant condition as intellectual disabilities and developmental delay that will impact that child for the rest of their lives. So really, I am a strong advocate that all women should have a thyroid function test early on in their pregnancy. Now, hyperthyroidism in the mother can cause significant problems in the baby. Why? Because if the hyperthyroidism in the mum is caused by Graves' disease, this can also lead to hyperthyroidism in the baby. And so when the baby is born, what will happen is the baby may have a fast heart rate, be irritable and have high-pitched cries all the time, as well as that baby having an enlarged thyroid when it's born. And so if it has an enlarged thyroid when it's born, whilst it's still a fetus in the mother's womb, it will be detected that the thyroid gland of that baby is going to be large. But ladies, if you have either of these conditions, no need to panic. It is very easy to manage them both. On to the management of thyroid disease. If you've been told you have hypothyroidism, your doctor should be prescribing levothyroxine. And this is an artificial replacement of the thyroid hormone that your gland is not making enough of. And your doctor should monitor your thyroid hormones by doing regular blood tests every 6 or 8 weeks, depending on what your levels are. And your blood test results should allow your doctor to adjust the dosing of your levothyroxine. If you have hypothyroidism in pregnancy, you should consider taking antenatal multivitamins that have an adequate amount of iodine. Because remember, the hormone is made on the basis of the gland uptaking enough iodine from the bloodstream. Hyperthyroidism, on the other hand, is managed with the anti-thyroid medication known as propylthiouracil. That's a mouthful. And this drug is used during the first trimester. And for the second trimester onward, the drug known as methimazole is used. But remember, I am not your doctor. I am a doctor on YouTube trying to educate the masses. So do not go by my advice. See your doctor who would tailor your management according to your clinical presentation. Again and again, when you have hyperthyroidism in pregnancy, you will need to see your doctor regularly, both to do blood tests to monitor what your thyroid hormone is, but also to monitor the side effects of the drug on the fetus. Also, if you have hyperthyroidism in pregnancy and you have been experiencing fast heart rate and tremors, a class of drug known as beta blockers can be used on a short-term basis to reduce your heart rate and to help control your tremors. Again, speak to your own doctor. That's all that I have for you for this video, ladies. I truly hope it's been helpful. Do remember that you could reach out to me in the comment section and ask me any question, and hopefully I will be able to answer them. But in the meantime, check out some of the many other videos that we've got right here on this channel. Take care, and I look forward to seeing you as a returning subscriber. So if you haven't subscribed, what are you waiting for? Do remember to subscribe and to smash on the like button. We'll see you later.